Minimally invasive lumbar fusion is a newer spine technique. The actual procedure itself is the same as a traditional open lumbar fusion, but the muscle damage and soft tissue trauma is significantly reduced, which helps the patient's outcome and recovery. Fusion is a term which we use, which means to weld two pieces of bone together, which previously had motion between them. Therefore, in a lumbar fusion, these are the vertebrae, which are the blocks of bone. They move through the disc. If that disc is abnormal, lumbar fusion is sometimes necessary. So in order to do that, we remove the disc completely and put a spacer with bone graft between there to allow the bones to heal together as one block. In order to support that spacer, screws have to be inserted into the bone with rods to hold it into place while the bone grows through the spacer to allow this to form one block of bone. A minimally invasive fusion differs from a traditional open fusion in that the incisions are much smaller. The amount of soft tissue damage and muscle damage is significantly reduced. Typical candidates for a minimally invasive lumbar fusion are patients who have a condition called degenerative spondylolisthesis. Spondylolisthesis is a term which means that one vertebra is shifted forward on top of the vertebra below it. The typical outcome for a minimally invasive fusion is very good, depending on the condition. Particularly for degenerative spondylolisthesis, patients do excellent. The success rate is greater than 95%.